It's not science fiction anymore as doctors turn to robots as assistants in the operating room. These mechanical devices give surgeons a clearer look at what's going on, and as Rod Starnes explains in today's cover story, they cut down on complications, letting people go home sooner.
Suzanne Davis needed surgery for a recurring medical condition, but she didn't have to go through an involved process that would have required a large incision. She also didn't need the traditional 6 weeks of recuperation before getting back on her feet.
So I'm still under a month. I'm completely mobile. I'm not supposed to pick up anything over 20 pounds, but I feel like I could. I swept out the garage Saturday.
Davis's surgeon had some high-tech help to get her in and out of the hospital quickly. For certain types of gynecologic cancer treatment, West Clinic rolls out the Da Vinci S, a robotic device that provides a clear view of what the doctors are operating on. One advantage is it is much less invasive than traditional surgery.
The biggest difference is that patients have very little pain. They go home, incredibly sooner. Most of them, if they're operating on in the morning, are home in the evening.
Doctors Mark Reed and Todd Tillmans of the West Clinic use the robotic device in the treatment of gynecologic oncology. When they treat cancer in women, the device makes 5 small incisions in the midsection. 4 mechanical arms are inserted into the body. A 5th has 2 cameras in it, giving surgeons an almost 3-dimensional look inside the body.
For instance, when we're doing lymph node dissection, you can see right on top of the vessels, individual blood vessels, individual lymphatics. It's unparalleled.
In addition to the improved view, surgeons can control precise movements by moving a couple of fingers, a turn of the wrist, and pressure on foot pedals, all at a console that may be across the room from the actual patient.
On the laparoscopic side of things, you don't have the single-dimensional movement of the laparoscopic device. You have, 7 degrees of freedom at the tips of the device so that you have unparalleled dexterity inside the abdomen.
Davis, a high school teacher, says at first people have a little trouble accepting how easy and uncomplicated her procedure was.
They're like, wow, I can't believe this. This is almost like something out of a movie. I said, it is. You're in one spot and the surgeon's across the room, and the results are just phenomenally better.
Doctors say there are other benefits to laparoscopic procedures using the robot. Because it's not conventional surgery, there's less chance of infection, and that means patients can get up and around faster.
They are fully functional, most of them within a week, most of them even 4 days. They take very few narcotics. I've had patients come to me and tell me they take no narcotics in the entire postoperative period.
The use of robots as surgical aids is growing across the Mid-South, making it easier for Suzanne Davis and others to turn the page to better health. For Smart Medicine, I'm Rod Starnes.